So if you have any questions after the presentation or during the presentation, please feel free to write on the chat. On my screen, I can also see your questions. So it is 3:07. I'm going to start now. Hi, everyone. My name Thank you for joining this session. My name is Ping. I'm an associate professor of family medicine in New Jersey Medical School. I was trained in sociology, and my main research focus is violence prevention and intervention. Dr. Novneet is the co-director of the program. He's the chair of the Department of Family Medicine and practices in both family medicine and emergency medicine in New Jersey Medical School. I'm going to talk about our recent funded mini program, Safe Voice, Safety Against Violence for employees through violence research intervention and community education for local health workers. Although this may sound like a mini program, this is actually a continuation of our gun violence prevention and intervention program in the past 4 years. As I heard from some of the presentations that their program results are not available yet, we have a similar situation. We received the grant notice in mid-February this year and got the funding in March. We are still in the process of data collection, but I feel that since we have been working in this area for 4 years, I would like to use this opportunity to go over our grant development process in the past 4 years and our view of future directions. This work was supported in part with funding provided by the New Jersey Center on Gun Violence Research at Rutgers University, New Jersey Health Foundation, and New Jersey Medical School. Gun violence is a major public health concern in the U.S. For every death related to gun violence, there are 2 more victims sustain non-fatal gun injuries. Gun violence are the leading method of suicide and homicide, and they account for half of all suicide deaths and 3/4 of homicide deaths. There are several risk factors of gun violence, including depression, substance use, intimate partner violence, and gun violence exposure. Depression and mental health illness can be a strong factor in suicide, and suicide accounts for the majority of firearm deaths. Alcohol and substance use and intimate partner violence also led to firearm suicides and homicides. Also, when a person becomes a subject of gun violence, the risk of someone in his or her social network becoming involved in gun violence temporarily increases. So for this mini program, we will create a voice program website to increase accessibility for the local medical community and make our content enduring. We will tailor and implement a hybrid program for university hospital and New Jersey Medical School staff. I'm going to talk about our previous programs in a minute, but I want to give you some background of this specific mini program. Recently, we received feedback from University Hospital and New Jersey Medical School that there is an urgent need for healthcare staff to receive training in gun violence prevention and intervention. We found that when we did the previous programs in our with our community members, actually our hospital and school staff assess whether they can also participate. Particularly, there are increasing violence toward health workers in the past 2 years. We saw this in the news and also in our local hospitals and schools. So the Association of American Medical Colleges recently reported that threats against healthcare workers are rising. Hospital safety directors reported that violence against healthcare workers increased during the COVID-19 pandemic in 2020. A recent national survey of more than 2,000 nurses indicated that almost half, or 48%, reported an increase in workplace violence. Our specific M1 is to create a voice program website to increase accessibility for the local medical community and make our content enduring. You can see that our website is still under construction. We are in the process of making this website accessible to the university hospital and New Jersey medical school community. We will promote the website through website use through the hospital and school email system. The uses may include clinical and non-clinical staff, students, healthcare providers, and faculty. We are currently working with Rutgers IT to track the use of the website. Our specific number two, specific M number 2 is to tailor and implement a hybrid voice program for university hospital and New Jersey medical school staff. We will conduct monthly learning collaborative sessions. 9 training topics will be conducted multiple times, depending on the needs of the medical community. We will continue to develop educational material related to gun violence related health topics, such as self-defense, de-escalation, psychological first aid, preventive healthcare, and other topics. Each session will have 5 to 15 participants. As we expect community workers to join longitudinally, we anticipate the sample size of the staff to be 50 individuals. So the expected outcomes, the proposed program will benefit our medical community members who are at risk for violence at workplace, including gun violence. It will also help healthcare workers to better provide violence prevention and intervention for their clients based on the trainer principle. These steps are necessary to create a culture of support around violence in the healthcare setting. So now I have been talking about the mini program, but as I mentioned, we have not had the outcome yet. So right now I'm going to talk a little bit about how we developed the program since 2019. So in 2019, the New Jersey Gun Violence Research Center announced this grant opportunity, and we applied for it. So we used the National Violent Death Reporting System data to explore the risk factors for firearm death in New Jersey. And our ultimate goal was actually to develop a collaborative violence prevention program among community and hospital partners. But we feel that because this is a new area for us, without knowing our own population demographics and prevalence of gun violence, we won't be able to develop a community program. So we got the National Violence Death Reporting System data from 2013 to 2017. Back then, those were the most recent data that we can get. So we look at the outcomes deaths due to homicide, suicide, and other gun-related injuries. We also look at risk factors that are available in the data system, including demographics, circumstance variables, and clinical indicators. So we did analysis. We conducted descriptive analysis for the outcomes and risk factors. So you can see that from 2013 to 2017 in New Jersey, there were 2,441 deaths related to firearm. The majority were homicide, 54%, followed by suicide, 38%, and others. And when we look at the hospital data, we found that actually some of the, about 1/3, close to 40%, were admitted to emergency rooms and the hospital. So because of that, we actually went back to look at our local data, our chart, medical charts, and we found that about 40% of the victims who died from firearm in our hospital, they were actually existing or previous patients of our practices or our hospital. So based on that, we developed a community program. I can talk about that later. So, but with regard to the risk factors, you can see that from the New Jersey data report system, we saw that Caucasians, individuals with mental health issues, and alcohol users were at higher risk for suicide. Youth and African Americans had higher rates for homicide. And Caucasians, women, victims of intimate partner violence were at higher risk for homicide, suicide. So we concluded that for firearm violence, forms of firearm violence may be associated with different health risk factors. And there is really a need to develop community prevention and intervention program. So in 2020, the pandemic hit. So we were thinking about what we can do. So last summer, I worked with some students to develop virtual prevention and intervention sessions for community members. So we have a few steps that we did. We identified the risk factors from the literature, and we met every day, and we did PowerPoint presentations. We selected 9 topics that I mentioned about. I will also talk about that later. And these are the 9 topics. So we look at the literature, we found that these topics are very related to gun violence, including intimate partner violence, substance use, drug use, and general violence. And because of the COVID, we also added a session on COVID based on community organizations' request. So then in 2021, after the pilot test, we fully implemented this program to the community. And we really appreciate that New Jersey Gun Violence Research Center continued to fund us. So we work with students, resident physicians, and some faculty members, and also community organizations to test this community program. We did about 110 pilot tests, surveys, and educational sessions. So through this program, we developed this pre and post evaluation. And also when we went to our OBGYN to do the pilot test, they gave us feedback. They told us that, for their population, they really, uh, uh, PowerPoint slides may not work for our populations. So we converted all the PowerPoint presentations to animated videos. So from here, you can see for each topic, we have animated videos go with that. So those animated videos, it lasts about like 5 to 7 minutes, very short. And for pre and post surveys, they last for like 1 minute or 2 minutes. So we have that for all the 9 topics. And then 2022, we fully again continue the project in the community. So I'm not going to repeat that, but here the slide just shows you how many activities we have done. So you can see that we work with about 20 community organizations. We made an appointment with them, gave them training, and contact their clients. So I have probably 2 more minutes. I just want to give you some evaluation of this program. So there were a total about 1,700 individuals who watched our videos. And the majority were minority population, and most of them were younger than 45 years, and the majority were male. So you can see from this, we also asked questions about their exposed to gun violence. So you can see that our community population, they are really exposed to gun violence and other forms of violence. And for post-intervention knowledge assessment, you can see that it was very well received. Over the post knowledge test score is over 90%. And then almost all of them are satisfied with the video sessions, and they would recommend it to their friends. So this is the summary of the program results and the conclusion. Thank you so much. I don't know if you have any questions. Feel free to ask questions. If you don't have any questions, I'm going to leave my email address in the chat. Feel free to contact me and give me comments. Thank you. Thank you for joining this session. Have a nice weekend. Thank you so much. Bye-bye.